Started timing.
Next page, ma'am. Any other page, ma'am?
Oh. Starting your 10 minutes time.
Hi, I'm Dr. Muthulakshmi, one of the doctors posted here. How may I address you?
Samantha is fine, doctor.
A, please.
I am 45-year-old.
Samantha, I can gather from your GP letter that you have come here with some concerns regarding your water work. Am I right?
Yes.
Samantha, since we are meeting for the first time, is it okay to ask few more questions to know more about you? Then together we'll form a safe and acceptable plan of management. How does it
Yeah.
sound?
Yeah. Go ahead, doctor.
Samantha, could you please tell your own words about your concerns?
Yeah, doctor, I want to know what is wrong with me and whether I will able to get cured of these symptoms. Actually, since last 1 year, I have noticed that I leak whenever I cough, sneeze, get up. And since last 6 months, it has been aggravated to the extent that I cannot carry out my day-to-day activities. Even if I go out, I always have a fear of getting wet because of coughing, getting up. And recently, I have started using towels also so that I will not be wet. It's distressing, doctor.
Samantha, I can see you're passing through a very tough time, and don't worry, we are here to help you.
Yeah,
And
doctor.
we are here to help you. Have you
Yes.
tried any treatment for this?
Yeah, I visited a GP. He has advised some urine investigation,
Hmm.
but and some exercises, but it's not giving me any relief.
And have you been ever treated for waterwork infections?
Yeah,
And do you rush to the toilet?
no.
And how many times you pass urine on the daytime and the nighttime?
I go quite frequently during day. At night, I do not go. During day, if I am full, actually, I quite quickly leak. So to avoid that, I go frequently.
And any mass you are seeing down below?
No,
Any discharge down below?
no.
And what about your bowel opening?
Yeah, perfectly, absolutely fine.
And I'll be asking few personal questions. Is it okay?
Yeah.
Maybe intrusive. So,
Yeah.
are you sexually active?
Oh, yeah, actually, I have recently met a new boyfriend and we are staying together, and that is also causing me embarrassment, doctor.
Yeah, surely we'll address all your concerns, Samantha. And when was your last period?
My periods are pretty irregular because I thought it's because of the menopause I'm going through. My last period was 1.5 months back.
Mhm. And are you taking any hormones for the
No,
symptoms?
no, I'm able to tolerate it.
Are you up to date with your smears?
Yeah.
I can see from your notes you have 3 kids.
Yes, doctor. They are now adult, teenager.
Okay, all born vaginally.
Yes, they all born vaginally.
And how are they doing now?
They are doing well.
Okay. And any complaints like this you had during pregnancy or a post delivery?
No, my last delivery was quite a tough delivery. That was a prolonged. My baby was 4 kg plus, so it took quite a long time. So at that time, I had a tear also, which was not very bad. And yeah, after that, means it was a prolonged delivery.
And how was the recovery after that?
Yeah, it was fine.
And any exercises advised at that time?
Hmm? What
Any
exercises?
any pelvic floor exercises,
Yeah,
muscle.
yeah, yeah. I was quite doing that. That time I used to do.
Okay. And any non-medical conditions or any medicines you are taking?
No,
Any surgeries in the past?
no,
Any allergic to medicines?
no,
And any family history of concern, like any cancers in your family members or a
no,
clots?
no.
And few personal questions. Do you smoke?
Oh yeah, I smoke 10 to 15 cigarettes a day.
And have you thought of quitting?
No, doctor, I have not.
Okay. So I'm not being judgmental. Smoking in general is not good for health, and also it aggravates this condition.
Yeah, I know, but I will think about it.
Oh, okay, fine. So aware of your height weight ratio,
Yeah, it's 36.
and are you trying any exercises or any diet? Put in touch with dietitian or a physiotherapist.
No.
And what do you do for your living?
Actually, I am a nurse specialist working in a geriatric ward with geriatric patients.
And are you well supported with your family?
Yeah, I do have 3 kids and I'm in new relationship also.
And shall I examine you in the presence of a chaperone with your consent?
Okay.
And so you said the GP ordered a urine test, right? So it was
Yeah.
told to be normal.
Yes.
And is there any scan done, like to know how much urine is remaining after
No. No.
first? So, and as you said, like we are rule, the GP said urine test shows no infection. And we'll also do a one scan for your water bag to see how much urine is remaining after you empty the bladder.
Yeah.
So coming on to this symptoms from the history, and it is looking like a stress urinary incontinence. Have you heard of it?
No, doctor, what it is?
So I'll just draw for you. And this is a water bag. We'll call this as a bladder. And this is a water pipe, which is called as a urethra. Normally, this angle will be maintained at an angle which prevents the urine leak. Like
Mm-hmm.
whenever we cough or whenever the tummy pressure increases, it gets closed.
Okay.
In some conditions, in women with previous normal vaginal deliveries, in increased height to weight ratio, or having some problems like chronic constipation, so and post menopausal women, so this problem gets aggravated. So whenever there is a increased intra-abdominal pressure, that leaks.
Okay.
Are you getting it?
Yeah.
So the first line recommended treatment for it is a lifestyle modification. So one
Okay.
is that doing exercises. Okay. So the GP already advised you exercises, so which has to be done with the supervision of a physiotherapist. So which is
Okay.
called a pelvic floor muscle exercises. So that is the squeezing down below muscles to contract whenever you want to hold a urine when you go outside.
Okay.
Which needs to be done like 8 times 8 times we need to repeat each time, and it has to be done 3 times per day. Are you getting it?
Okay. Yeah.
And it has to be done continuously for minimum 3 months to see its effect, and it has to be continued lifelong also. Am I clear so far?
Okay. Okay.
And the next thing is doing a, a lifestyle modification, like doing diet and doing some exercises to lose some pounds of weight. So it helps in the long run to reduce these problems also.
Okay.
I'll put in touch with a dietitian and physiotherapist. They will guide them how to do further.
Okay.
So, and the next option is going for a surgery.
Okay. Can you explain me in detail about the surgery?
Yes. So, surgery, like where we'll support the this in this picture you can see where we'll lift the water pipe that is called urethra, and which supports leak of the urine. So
Mm-hmm.
the surgeries we have was like birch colpo suspension. Okay. So next thing is we can use some sling surgeries. So can I explain more on that?
I wanted to know means what exactly the
Yes.
surgery involves.
Okay. So either it can be done through open tummy incision or in the keyhole with the experts. So what we'll do is, so we'll elevate the water pipe, and by putting some stitches on either side of the water pipe. So that is called a birch colpo suspension. Okay. So since it is a major surgery, so there may be some complications with anesthesia and injury to the nearby structures. Am I clear so far?
Okay, quite clear, doctor.
Yeah. So the surgery usually will be successful about 7 in 10 women, but sometimes women may
Completed your 10 minutes time. I'm giving you extra 2 minutes, okay?
women may experience voiding problem after the surgery.
Yeah, okay.
And other surgeries where we'll use body's native tissues to elevate this water pipe. Okay, this is called a sling surgery.
Okay. Is there by any chance there will be a chance of recurrence?
Usually, when the risk factors are corrected, the recurrence will be less.
Okay. I have
So,
heard about TAP procedures.
sorry,
I have heard about TAP procedures.
uh, you have heard it?
TAP procedures.
Yeah.
There is a
So,
lot about
tape
TAP.
procedure. Yes. So, tape procedure is at present on the hold in NHS because of untoward complication.
Okay.
Am I clear so far?
Okay.
And there is also called another medicine, so drug, which is called a deloxetin. So which is usually given for a woman who's not willing for a surgery or not tolerating surgery because of some medical concerns. It is not very effective. Am I clear so far?
Yeah, quite clear.
So are you having any concerns till now?
No, doctor. Thank you.
I'll give a detailed patient information leaflet and connect to the counselors and support groups, and also I'll inform my consultant.
Okay. Thank you.
Thank you.
Well done, dear.
Not red, ma'am.
No, but well done. Only time issues again.
Yeah, I forgot that surgery names and all. Suddenly, it was not coming to my mind. What history till that explanation, I was clear.
Yes. But managed very well. 1 or 2 points here and there.
Yes.
You able to cover the maximum points. The way you drawed and you have drawn and shown me what is SUI. The same time you can take a help of for drawing for showing surgery. What exactly you are going to do? You are
Mm.
already drawn for me. So the same drawing
Yes.
can be used. So the neck. So your conversation will be shortened whenever you are using drawing.
Yes.
Your communication will be shortened with the patient, though we will be taking a stitch around this snake and tie uplift it
Yes.
up, lift it
Yes.
up wherever whatever way you are lifting it up. Okay, so it will
Okay.
get closed whenever there will be increased pressure in your tummy.
Mm. Yes,
Hmm?
ma'am.
So the aim of the surgery is that tape procedure are not being offered as of now because of some concerns. You can set some concerns. Do not go in the details. Um Recurrence less likely, which you had mentioned. So overall, it was good actually. I have not. Anybody wanted to point it out any mistake? Anybody? Because per se, I couldn't able to. Means how are you doing? Means recovery, post delivery recovery. Those points are not very important.
Yes, ma'am.
Whether there was any bowel or bladder symptoms after the traumatic delivery, that you can at least ask.
Okay, ma'am. Simply. Okay, ma'am.
Okay, because we are dealing with the bladder problem. So whether there were any similar situation at that time, so that will be a relevant question here. How means I will not be happy with the question what you asked me. Okay, how I recovered and how are they doing well. Okay, so whether your kids are doing well or not, I wanted to know their birth weights.
Okay, ma'am.
Okay, so how they born and what
Mm.
are the MODs, mode of delivery and birth weight. Yes, dear. Yes, ma'am.
Yeah, ma'am, can we offer them like one of the options as urethral bulking agent?
First line is actually colposuspension. So first
Yeah,
line is colposuspension or surgery, you can say.
yeah.
There are different surgeries which are available: sling surgery, colposuspension, and bulking agents. Okay, so bulking agent basically when it's in a different
Like,
yeah, it's in a different yeah. This repeated injections and all those things are there, so you can tell her that the surgeries are different and you can name them bulking agents or something like that. But in this task it was called per suspension. What I wanted to know, the risk associated with this, any new bladder symptoms, how to tackle it, even retention is one of the common symptoms after this surgery. Yes. Hello, am I audible?
Yes, ma'am. Audible.
Yeah, so retention is also one of the important symptoms. So overall, I feel you have done a good job. That what you history you missed out, uh, I am drinking caffeinated drinks. I am drinking
Yes, ma'am.
tea.
Drinking habits. Yeah, yeah. I was
Yeah, I
thinking
am
to ask, then
drinking
I
tea.
forgot. Yeah, flu
Yeah.
drinking
So
habits. Yes, ma'am. Drinking
yeah, so
habits. I
this
forgot.
drinking habits has been missed out. Then offering me a bladder diary, fluid diary.
Because if I asked this, then I could have remembered bladder dairy food day, right?
Yes. Okay. Although it is thing, but would like to offer you a bladder diary so that I can have a proper assessment. The another important point, what about urodynamic testing?
Uh,
not
Urodynamic testing, it's not for a done for a primary SUI.
Yes. So that sentence you need to say. That is knowledge.
Mm.
uh,
Okay. A special test called as urodynamic test will not be required in your case since it seems to be a simple stress urinary incontinence. That is the sentence what I wanted to heard as a applied clinical knowledge. Okay.
Yes, ma'am.
Uh, Apart from that, MDT.
I left.
MDT is communication with colleague,
Mm.
patient safety, two domain. Okay.
Yes, ma'am.
Anybody else? Anybody else wanted to point it out anything?
Ma'am, the
Hmm?
avoiding shifting the patients. I mean the weight
Avoiding?
weight weight lifting, ma'am. The patients, the
Yes,
geriatric
yes.
patients.
Why she is having that? Actually, it's because of her occupation. She is working in a geriatric ward. So avoid heavy lifting. Hmm? So change of occupation also you can say. It is not been mentioned, but at least you have to advise that
Mm.
constipation and chronic cough, that history one point you have to ask, and heavy lifting. By any chance your work involves lifting heavy weights? Yes, I am working with geriatric patients. I am their nurse assistants, so I do have to do at a time.
Okay, ma'am.
Okay. Yeah. So overall, these two, 3 points were missing. Let's go through the answer key. Uh, First part introduction, GP letter, aim discuss urinary problems as per GP letter, setting agenda. What is wrong with me? I wanted to know. Simple communication task. Again, signposting because you know that elderly urinary complaints, you are going to ultimately ask sexual history also. Leak, crush, pain, retention, bulge, nocturia. How badly it is affecting your quality of life. That I told you. So, and
Yes,
you
ma'am.
acknowledged also. Yeah, you
Yes.
acknowledged also, but at least say, yeah, I can see it's affecting you very badly. Okay, so something like that. Yeah, offer some sympathy, some positive words. So what have you tried? Any fluid diary, bladder diary? If not, then offer one. These diaries are also important.
Yes.
Basically, in the instructions, they have not mentioned what she has tried. So I just said that, okay, if GP has advised at least urine infection ruling out and basic physiotherapy. Menstrual history, it's pretty irregular now because I'm attending a change. So, HRT, you had asked me, you can ask whether I'm able to cope up with my menopausal symptoms or do I need a help. This one question can be asked. Okay. I told myself only no, it's so I am able to manage it. But if the patient is saying, I thought of it because of the menopausal changes, but I'm not on an HRT. So if that is a sentence, you can ask her here, are you able to cope with this situation or would you like to uh, discuss hormone replacement therapy? This can be asked if I am not showing any, I am not giving you details that I am able to tackle. Okay, symptoms. Ops history, mode, birth weight. These two important things are important. BMI, height. Trying any measures to minimize it? No. Yes, walking. Yes, I am doing, but it is not giving me any relief. Huh? So help will be community weight loss. If I am trying and not getting lose, I am not able to lose. Community weight loss program can be offered. Dietitian reference. Smoking, alcohol, caffeine, aerated drinks, any medical, surgical allergy. So this history is missed out. Acknowledge difficulties but not addressed anytime. Okay, so once the treatment will be successful, your sexual difficulties will get solved. At least say this word. Hmm? Looking at symptoms, it's trace urinary incontinence. Okay, check her background knowledge, what she knew, which you had checked. Explain SUI, you had drawn a diagram. Why? It's because of multiple factors: advanced age, menopausal status, high BMI, and trauma during vaginal delivery. Not life threatening, but embarrassing. Reassurance, but the treatment is available. So, what are the treatment options here? I will suggest coping strategies, toiletries, scented products, and pads because she is leaking a lot. Huh? So, this is my first line. Second line is lifestyle. Important to quit smoking, working on high BMI, avoid drinks, rule out urinary tract infection. Do not go into the details whether the GP has advised or not. If it has not been documented properly, you just say that I would like to rule out any urinary infection, and if positive, then antibiotics. Blood sugars. Okay. Uh, uh, you have to manage your fluid so that you will not drink more than 2 liters of fluid per day. Kegels. Along with this, supervised physio, 3 months. Transvaginal scan or bladder scan for retention of volume. Very nicely, you had explained me in details how to do it, Kegels. But if you think that the task is not Kegels and it is surgery, so ask her whether I need to explain you in detail about Kegels. Because in this task, it was about surgery, where I wanted to know in detail about surgery. Okay. So that will take your time, consume. So you ask whether you wanted to know about Kegels. Local estrogen or HRT for menopausal symptoms. Hmm? Even the local atrophy is increases the SUI. So local estrogen can be applied. Any history of blood clot, cancer, breast in the family, if you are going to offer her HRT. You ask this question, check her BP. Check her BP also for HRT. No UDS as seems to be SUI by history. This is a sentence what you need to say because whether to offer this urodynamic testing is or not to offer, that is shown, means that is been said by you. Okay, unless and until you will not say, the kick box will not be completed. Okay, whether it is needed or not needed. So if not needed, you say it is not needed. Involve MDT for further options if these primary measures failed. MDT, you can take a name of the MDT people. So the urogynecologist, gynecologist, continence nurse, elderly people, and the physiotherapist, colorectal surgeon. So this will be a part of team, and the options will be discussed with you. That will be a sling surgery, either done by open or laparoscopic procedure. No tape surgeries has been recommended, or not. No tape surgeries has been offered as of now in NHS. Pros: effective in 85 to 90% of the cases. Cons: sometimes there might be a new onset bladder symptom like OAB. You said OAB. Do not say OAB. Say urge, or you may have to rush. You may have to rush retention. Okay. Surgical risk and sometimes injury while operating. MDT will discuss if primary measures fails, the surgical options, whatever surgical options suits with you, they will discuss. Okay. And lastly, a drug. So drug is if somebody doesn't want to go for surgery, not fit for surgery, or time being duration. The pros and cons of the drugs: success rate, yes, but it is associated with constipation, blurring of vision, hmm, and sometimes insomnia. Till that time, maintain bladder diary, rule out urine infection, avoid smoking, work on your BMI, avoid caffeinated fluid. GP letter, writing back to a GP letter, you missed out on this. Yes?
Yeah.
And continence nurse referral. And if possible, I will arrange a coping strategy, that continence nurse referral will be helpful for that. The toiletries products and scented products for her acute need. So that is closing a loop. Okay. And what is a Bladder and Bowel Foundation UK is a support group associated with all bladder symptoms and bowel symptoms in UK. Okay. Remember this urodynamic urology or urogynecology module is having only one or two, three groups, support group. Please remember that. Okay. And patient information leaflet of SUI. So closing was not a problem. So now coming to the domain scoring. Patient safety: confirm patient's identity at the start of the task, outline safety issues, tape for sling surgery. So you mentioned that. Empower patient to make an informed choice, discuss safety of drugs prescribed for control of symptoms. Safe prescription for menopause symptoms having excluded allergies. Okay, so they had mentioned all these points. Applied clinical knowledge, pathophysiology of stress incontinence, discuss basis of treatment, which you had discussed. Surgery can be performed without urodynamics, that is applied clinical knowledge. Explain the type of surgery, benefit plus complication. So overactive bladder, failure rate is 10 to 15%, problems with bladder control and sometimes retention. Discuss the details of surgical options, the type of anesthesia and post-operative course. You can say, means if you can ask here whether the patient wanted to know in detail, because many a times we might not be having this much time. uh, Demonstrate the current use of NICE guideline to form a basis of management. Obtain good history which demonstrate an understanding of the clinical problem. Initiate appropriate investigations to help make a diagnosis. Fluid diary, urine analysis, blood glucose, urodynamics if necessary. Here it is not necessary. Okay, here it is not necessary. Communication with patient and families. Explain diagnosis of SUI. Need for further investigations. That is PVR, urinary infection, urinary tract infection. Bladder diary, fluid diary. Discussed options: lifestyle, physiotherapy, and drugs. The treatment of choice here is, or the recommended is, surgery after lifestyle modalities. Sling procedure are those of the choices. Menopause and the symptoms you can discuss here. Discuss weight sensitively and benefit of losing weight. Okay, if possible, you can discuss all these points. Smoking you discussed. Communication with colleague. Discuss refer to urogynecology team, which you missed out. Specialist nurse, incontinence advisor, and urogynecologist. MDT in the treatment wherever appropriated, especially before the surgery, we need to involve this. Okay. Overall, means impromptu, without preparation, a good presentation. What I feel.
Okay.
Anybody's having any question? Okay, so shall I end it?
Yes, ma'am.
Yes, ma'am. Thank you, and hope to for same sessions